Welcome back. September is Suicide Awareness Month. Elizabeth Tucker with Volunteer Behavioral Health joins us now to talk about this. Thank you for being here.
Yeah, thank you for having us.
Yeah, an important topic to cover, and what's perhaps most important is recognizing signs that someone may need help. What are some things that we should keep an eye out for to notice if someone may be struggling with their mental health?
Yeah, so if somebody is talking about feeling depressed, they're isolating more. Also, if they start talking about they're feeling hopeless, they don't have hope in their life, or even like that they're a burden to other people, if you start hearing those types of things from your friends or family.
Absolutely. And it could be a difficult topic to bring up. There might be a stigma, attached to this. What role does a stigma play in preventing people from seeking help?
Yeah, I mean, we've done a lot to try to break the stigma, but it's still there. You might have someone that says, well, you don't have anything to be depressed about, or your life isn't that bad. Think about so-and-so or this type of person. And so really just letting people know, like, you're not comparing yourself to other people.
Sure. And on that note, what are some ways that we can support a friend or a loved one through that journey?
Well, yeah, being there, like you said, being supportive, making sure that you're helping them find resources, and even offering to call with them or for them to kind of open that door if they're feeling a little nervous to do that.
As we noted, September is Suicide Awareness Month. Why is this something that you are passionate about, just promoting and getting the word out there that there is help available?
Yeah, I feel like the more we talk about it, the more it lessens the stigma for one, and then also it empowers people to say, you know what, I'm not okay. I can get help from someone.
If someone's not feeling 100% themselves, maybe they need some extra support and some help, what are some of the first things that they can do in that situation?
One, talk to anybody. It doesn't have to be a professional, but get somebody in your corner, and then you can call and text 988 anytime. It's open 24/7, and so that's something that you can always reach out to.
That 988 number, should people not be afraid to reach out to it? I feel like it might be a little bit scary, for lack of a better term, to call that number, and what do you say when they pick up?
Yeah, so if somebody calls 988, the person that answers is just there to make sure that they're okay, and if they're not feeling okay, letting them know if there's options. There's crisis stabilization units for adults and children, so it doesn't mean they have to be hospitalized. I think that sometimes is a fear. And then also making sure that they can have a safety plan, because we want them to be here with us tomorrow.
I think it's great that you can also text that
line.
line.
Oh, for sure, especially for teenagers.
Yeah, absolutely, making it accessible and maybe a bit less scary.
Exactly.
Depending. So what message do you want to leave people with today?
That they're not alone, that if you or your loved one is feeling like you're not feeling like yourself, like you mentioned, just reach out to someone. There's a lot of mental health professionals that want to help, because again, we want to make sure you're here with us tomorrow.
Absolutely. So many resources available. We want to make sure that people get connected to them. So we are going to post this on our website, which is WKRN.com, with